Electrical stimulation is an introduction of electrical stimulation across the skin to excite nerve or muscle tissue. Neuromuscular electrical stimulation is the application of electrical stimulation for improving motor performance through the intact peripheral nervous system. NMES uses pulsed alternating electrical current, also known as AC, to stimulate a motor response by depolarizing intact peripheral nerves. Some indications for use are to restore force generation in muscle following ACL surgery, reduce muscle inhibition due to joint pain and effusion, for patients with OA and RA, restore motor control and force generation following total joint arthroplasty, maintain muscle health in peripheral nerve injuries, patients with Bell's palsy, reduce or prevent shoulder subluxation after stroke, facilitate active contraction following stroke to improve sensation in patients with chronic stroke, improve range of motion in patients with chronic stroke, improve function in patients with permanent central neurological deficits such as spinal cord injury, improve function in children with CP, improve muscle and respiratory function in patients with chronic COPD, improve bladder control in patients with stressor urge incontinence.
Caution should be used in areas of absent or diminished sensation.
Avoid treating over anesthetic skin.
Avoid open wounds.
Avoid areas of extreme edema.
Avoid areas of heavy scarring.
Do not place electrodes over the laryngeal and pharyngeal or near carotid sinus.
Chronic use of corticosteroids.
Avoid current amplitudes that patients find very uncomfortable.
To set up the electrodes, the negative and positive wires are securely inserted. Patient is prepared with alcohol wipes before applying electrodes.
In general, for NMES, place one or both of the electrodes over the motor point of the muscle of interest. A motor point for a muscle is that point on the skin that overlies the band of motor end plates. For a nerve, it is a point where the nerve is close to the skin. When the motor point is stimulated, as opposed to any other area of the muscle or nerve, a stronger response is observed. Charts have been developed to assist in the placement of electrodes. Although these charts have been made, it is important to have a thorough understanding of the anatomy of muscles and their interventions to stimulate the muscles most effectively. To locate a motor point, place the electrode in the area of the motor point. Increase the current amplitude until a comfortable contraction is obtained. Note the amplitude and observe the quality of contraction. If the contraction is not the desired response, or if the patient complains of discomfort, turn the current down to 0 and move the electrode to a nearby location and return the current amplitude to the same level. Continue this procedure until you locate the site at which the contraction is the strongest at the same amplitude at the first contraction. This is the motor point. Make sure that the correct muscle is responding. Because the skin impedance is lower at the motor point, patients frequently state that the stimulation feels better when the motor point is
2, 3.
Arrange the electrode so that the current runs lengthwise through the muscle or muscle group. To prevent a short circuit, electrodes should not touch each other or be closer to each other than the diameter of the smallest one.
For NMES, we're going to select electrotherapy, asymmetrical or biphasic waveform. We're going to edit this. We're going to put the phase duration on 640 microseconds.
the frequency at 80 hertz. The CC/CV is going to be at MACC. The burst frequency is going to be 0 BPS. The amplitude modulation is going to be 40%. The cycle time is going to be 4/12 ratio. And the treatment time is going to be 10 to 12 minutes. So we will just put it on 10. To start the treatment, press the start button and slowly turn up the intensity until you get a response.